Hi, in this video, we will be talking about diabetes. So what is diabetes? It is a group of diseases that result in too much sugar in the blood, also known as high blood glucose. So there are four types. So type 2 diabetes, also known as adult onset diabetes, is a chronic condition that affects the way the body processes blood sugar, or glucose. Type 1 diabetes, which is much more rare and also called juvenile diabetes, is a chronic condition in which the pancreas produces little to no insulin. Prediabetes, which is also known as impaired glucose tolerance, is a condition in which blood sugar is high, but not high enough to be type 2 diabetes. And gestational diabetes is a form of high blood sugar affecting pregnant women. So there are some different symptoms between the different types of diabetes. So for type 2, there you could experience excessive hunger, excessive thirst, fatigue, abnormal weight gain or loss, frequent urination, blurred vision, or poor wound healing. For type 1 diabetes, you could experience the same symptoms, but also experience fast heart rate, headache, vomiting, and sleepiness. Prediabetes is similar, has the same symptoms as type 2, just like to a lesser extent because it's not as severe as type 2. And in gestational diabetes, it is common to not experience any symptoms. So in order to be diagnosed with it, you have to do a blood sugar test. What are some ways to prevent diabetes? So there are many ways to prevent it. The first one being get more physical activity. The recommended amount is 30 minutes of daily exercise 5 days a week. And the exercise should be of moderate intensity, like brisk walking or bicycling. It's also important to get plenty of fiber and go for whole grains and lose extra weight and skip fad diets and just make healthier choices like limit carbs and saturated fats and stop smoking and drinking. And when should you go to see a doctor? You should go if you are 45 or older, or if you're an overweight adult of any age with one or more additional risk factors like a family history of diabetes, a personal history of prediabetes, or an inactive lifestyle.